The SDGs Explained, Episode 3, Good Health and Well-Being. The third of the SDGs is good health and well-being, a goal that can be broken down into three broad categories: reproductive, maternal, newborn, and child health, infectious diseases, non-communicable diseases, mental health, and environmental risks. In many ways, incredible progress has already been made in health and well-being. As science has developed, the quality of healthcare has increased, and with it, so has the quality of life in many places. But the rate of progress is slowing, and again, we're already running behind on our target. So where do we stand? Let's first look at reproductive, maternal, newborn, and child health. In 2017, the global rate of maternal death saw a 4% reduction compared to 2015, and a 38% reduction compared to the year 2000. Undeniably amazing progress. But that still equals 211 maternal deaths per 100,000 live births. A majority of these deaths occur in low and lower middle income countries. Roughly 66% of those deaths occurred in sub-Saharan Africa, which accounts for around 200,000 maternal deaths per year. Worldwide, 81% of childbirths were assisted by skilled health professionals between 2014 and 2019. That's up from 64% in the period of 2000 and 2005. Central, Eastern, and Western Asia, along with North America and Europe, have nearly achieved full coverage. Preventable deaths of children under 5 have steadily fallen from 76 deaths per 1,000 births in the year 2000 to 42 deaths per 1,000 births in 2015, falling again to around 39 deaths in 2018. These numbers are heading in the right direction, but the problem is still very real. 5.3 million children died before reaching 5 years of age in 2018 alone. Nearly half of that group, 2.5 million, died within the first month of their life. According to Save the Children, complications of pregnancy are the #1 killer of girls and young women aged 15 to 19. 50,000 young women die during pregnancy or childbirth every year because their bodies simply aren't ready to bear children. The charity also notes that 2/5 of births in developing countries are unintended, with millions of women unable to access family planning services. It's clear that more needs to be done to strengthen the systems of healthcare. With that in mind, let's turn our attention to infectious diseases. In 2018, there were an estimated 1.7 million new HIV infections, with 1 in 3 new HIV infections globally occurring among women aged 15 to 49 in sub-Saharan Africa. HIV, or human immunodeficiency virus, is a disease that attacks your immune system and makes it harder to fight illnesses. Preventing the spread of HIV and making treatment for HIV more accessible is a big step in reducing preventable deaths. In 2018, an estimated 10 million people fell ill with tuberculosis. 89% of those people were adults, and 8.6% of them were living with HIV. The incidence of tuberculosis has been declining from 141 cases per 100,000 people in 2015 to 132 cases per 100,000 people in 2018. The mortality rate among HIV-negative people fell by 8.3% in the same period. But large gaps in detection and treatment are a persistent problem, and drug-resistant tuberculosis slows down progress. Both of these are major factors to improve in order to meet our 2030 targets. Similarly, after years of impressive reduction, the fight against global malaria cases is stalling. There were 81 cases per 100,000 people in 2000, which fell to 57 cases per 100,000 people in 2014, and has stayed at a similar level ever since. In 2018, 1.76 billion people were reported to have required mass or individual treatment for neglected tropical diseases. That's down from 1.8 billion in 2015 and 2.19 billion in 2010. The 530 million people requiring treatment in the least developed countries represented 52% of the population of those countries, down from 78% in 2010. Progress is largely driven by the fact that in 40 countries, at least one neglected tropical disease has been eliminated in recent years. Now let's turn our attention to non-communicable diseases, mental health, and environmental risks. Non-communicable diseases are health conditions that aren't contagious. They are chronic diseases and can be caused by genetic, physiological, environmental, or lifestyle factors. The probability of dying from cardiovascular disease, cancer, diabetes, or chronic respiratory disease between the ages of 30 and 70 decreased by just 1% between 2010 and 2016. This is just far too slow to meet the SDGs. Screening for non-communicable diseases helps catch a problem early, which is vital for providing aid and greatly reduces the chance of illnesses progressing. Death due to tobacco-related illnesses were estimated to be 8.1 million in 2017, and in 2016, indoor and outdoor pollution caused as many as 7 million deaths worldwide. In the same year, inadequate water, sanitization, and hygiene led to a total of 870,000 deaths. Promoting healthy lifestyle choices greatly reduces the chance of getting these illnesses, and investing in healthcare and research will support treatment for people who are ill. According to data from 2016, 800,000 people die every year by suicide, and 79% of global suicides occur in low and middle-income countries. In 2018, the UK deaths by suicide rose by 10.9% to 6,507 in 1 year. Men aged 45 to 49 still have the highest rates of suicide in the UK. And over the last 9 years, suicide rates of people aged 25 or under have risen by 93.8%. The stigma around mental health is something that must be addressed, and investing in mental health support in work and everyday life is crucial to saving innocent lives. Helplines like Samaritans and Mind have been crucial to supporting people at risk. But in the UK alone, 23% of people, almost 1 in 4, who are seeking mental health treatment need to wait more than 3 months, and 11%, that's 1 in 9, wait longer than 6 months. In some cases, people living with severe mental illness, including eating disorders, bipolar disorder, and PTSD, are left waiting up to 2 years for treatment. Their health and, in some cases, their lives are put at risk because of this wait. So what needs to change? In 2017, less than half the global population were covered by essential health services, and many of these deaths and illnesses would have been preventable if that coverage were furthered. Immunization is one of the world's most successful and cost-effective health interventions, and while coverage has been improving from 72% in 2000 to 86% in 2018, 19.4 million children did not receive essential vaccines in the first year of their lives. And even in places where health coverage has the capacity to provide aid, care is often unaffordable. The proportion of the population spending more than 10% of its household budget on health services has continuously risen, from 9.4% in 2000 to 12.7% in 2015. Today, it's projected that 12.9% of the world, nearly 1 billion people, are spending far more on their healthcare than they can afford. The coronavirus pandemic has put a hold on many services. It stopped people in some cases getting the urgent care they need. In order to reach universal health coverage, we need to increase its availability and make it more affordable. So how do we do this? Promoting and protecting your own health and the health of those around you is a great start. By maintaining a healthy lifestyle, you rely less on health services, freeing up availability for those who need it more. Informed choices like safe sex and vaccinations are a great way of doing this. Community action is also a great way of ensuring others are informed and make safe choices too. It raises awareness for everyone's right to quality healthcare services, and it helps the communities around you to act and assist in those services. And as always, governments, leaders, and decision makers must be held accountable to ensure that access to medical care and health support is funded and regulated. They can do this by investing in hospitals, community care centers, and education. They can also communicate with scientists in other countries to make the best of their research too. And that was just a basic look at health and well-being, an SDG goal that makes a huge difference to millions of lives. And before we go, we wanted to highlight places you can find support if you need it. We've already talked about Samaritans in Mind, but the student services offer a wide range of resources for people that might need support. For more information on the SDGs, we recommend the UN website and the World Health Organization, as well as following us on social media. We have a wide range of blogs, events, and videos about sustainability that are great for beginners to learn more. Thank you very much. Have a great day.